Where this session is being recorded. I'm going to share the recording with everyone after the session and anyone who wasn't able to attend. So if you do need to leave, feel free, and you can always catch up with the rest of the recording whenever I share it later. But what was I saying? The PhD session will be separate. We're holding that on July 24th. So if you are interested in that program, you will want to register for that. Happy to provide the link. If you are interested, just reach out and let me know. But this session will be covering our DNP, MSN, and graduate certificate programs. I think that is all that I wanted to mention for now. So we are going to go ahead and get started. Let me share my screen here. Can everyone see that? Yes? Okay, great. All right, so I am going to turn this over to Dr. Pandian now for our first couple of slides.
Wonderful. Thank you, Cody. Welcome, everyone. Thank you so much for joining us today. I'm truly delighted to welcome you as you explore the next step in your nursing journey, whether you're preparing to become a clinical expert through either the certificate or DNP nurse practitioner options, or aiming to lead systems level change through our MSN administrator or educator or DNP in nursing leadership pathway. At the Ross and Carol Neese College of Nursing at Penn State, our mission is both clear and powerful. We are creating nurse leaders to transform lives and health around the world. So as DNP or MSN applicants, you are stepping into that mission, positioning yourself to lead, innovate, and make a lasting impact. Our vision is equally bold. We aim to redesign the landscape of health and nursing science through education, research, innovation, practice, and service. And this is not just a statement, it's a charge we live through our programs, our partnerships, and the nurses we graduate. Through the college, though the college was formally established in 2013, we experienced a major transformation in 2021 through a generous naming gift, becoming the Ross and Carol Neese College of Nursing, reinforcing our commitment to shaping the future of healthcare. So today we educate more than 2,000 students across 12 campuses in Pennsylvania, and through high quality online, hybrid, or in-person options, we offer the flexibility, accessibility, and a rich academic community for students like you. We're also proud to be accredited by the Commission on Collegiate Nursing Education, CCNE, through 2031, a mark of quality and excellence that you can trust. And an important milestone, our NP programs recently transitioned from master's to DNP level preparation, aligning with the national trends and elevating practice expectations. And our first DNP NP cohort graduated in 2024. And in 2025, we were ranked by US News and World Report, recognition that reflects our outstanding faculty, rigorous programs, and the success of our graduates. In addition to that, what else sets Penn State apart, especially for DNP students like you? First, you'll experience the best of both worlds, the resources of a top-tier research university with the personalized supportive environment of a close-knit college. So whether you're online or in person, you'll feel seen, supported, and challenged to grow. Second, our programs are flexible and research-driven. For DNP leadership students, you'll engage in high-level coursework in systems thinking, policy, and implementation science. For our DNP NP students, you'll train in evidence-based advanced practice with preceptors across diverse clinical settings. Across both tracks, you'll engage with faculty conducting cutting-edge research and translating evidence into practice, impacting healthcare delivery, health equity, technology, and leadership. Third, you'll become part of the world's largest active alumni network, over 750,000 strong. These connections span the globe and open doors in ways you may not even imagine yet. When I joined Penn State, I immediately saw the power of this network work because it's something truly special. It really creates a sense of belonging, of being part of this community. And finally, we're proud to have been named a Center of Excellence in Nursing Education by the National League for Nursing in 2022. This honor again reflects our commitment to innovation, inclusivity, and preparing the next generation of nurse leaders just like you. So whether you're pursuing a MSN or a DNP track, whatever pathway, this is a bold and meaningful decision. And it's really about becoming the kind of leader our profession, our patients need. And at Penn State, we're here to equip you with the knowledge, skills, and mentorship to make that vision a reality. So we'd love to welcome you to Penn State family. Thank you again for joining us today. I'll now turn it over to Cody, who'll share more about the program details. And as we proudly say at Penn State, we are
Penn State, you got it. All right, thank you, Dr. Pandian. Appreciate that. So as she alluded to, we are now going to move into some of the more program content slides. These are just sort of giving you all the details that we hope you will need. But again, if you do have questions afterward, we'll be happy to answer those. We do have, I don't see Dr. Farrell on just yet, but the rest of our coordinators for the NP options are all here, and the DNP and MSN options. So we are going to go through each of these sort of slide by slide and break down some of the important details that you might want to know. Just to get started with a rundown of all of the programs here, you'll see we have the PhD program, which is the only one offered only in person at our University Park and Hershey program campuses, rather. Again, if you are interested in that, feel free to reach out to me afterward for the link for that information session, which will be next month. For the DNP, we have several different options, all of which are hybrid. So there will be some on-campus intensives that you will need to attend, and then there will be practicum hours that you will complete at sites near you. For our MSN options, these are also hybrid, but the practicum hour component is much less significant than for the DNP, and there would be no on-campus intensives with the masters. And we have some graduate certificates as well that we'll be mentioning. We have two different options that would be 100% online, and then we have all of our nurse practitioner options available as a postmaster's APRN certificate as well, which would include that same kind of on-campus intensive and practicum hour time that you would find with the DNP. So moving into the DNP. Now, this is a list of our full options. We have leadership, which has been around with us for a while, and we have our new nurse educator option for fall of 2025. We're excited about that. We've seen a lot of demand for people that are interested in getting the DNP, but don't think they want to be an NP, don't think they want to go the leadership route. So hopefully being in that educator space will allow you to expand your career in a different way if that's what you're interested in. We have the 4 nurse practitioner options: family and individual across the lifespan, acute care, adult gero, primary care, adult gero, and psych and mental health. And we don't have a whole lot of information to share at this point, but just getting it on people's radar, we have a new nurse anesthesia option for the DNP as well, which we are planning to launch, if all goes as planned, in fall of 2026. So since we are still working through the approval process on that program, we aren't able to officially share information on that, but if you are interested, check back with us. Hopefully in a couple of months, we'll have some more information to share about that one. So now I am going to turn this over to Dr. Sherry Motter, who will tell you a little more about the DNP leadership and educator options.
Thank you, Cody. Sorry, I have a little frog in my throat for some reason today. So our DNP leadership option, you can enter either at a BSN or an MSN level, and then that depends on how many credits you will need. it is, there are 1,000 hours required in this program, and I know that sounds like an overwhelming number, but many of those are embedded in the courses you are taking, and the actual practicum hours beyond your coursework hours that are part of that are 550 hours. If you are coming in at an MSN level, you can transfer up to 550 of those credits. So if you're an NP looking to get your DNP, I think one time I had an NP who had to do 1 credit of hours the time you come in with hours. And also if you have your MSN, you've probably done some practicum hours before, and we do give credit for those. So this really prepares you to be nursing leaders within healthcare organizations. And we also, our NPs also find it beneficial at the practice level as well. Our nurse educator option really mirrors the nurse leadership option, except we take those leadership courses such as finance and leadership and embed education courses in there as well. So you get curriculum and also some clinical pieces with that. It has the same number of requirements, the same number of transfer. And again, you can come in at a BSN or an MSN level for this program. If you're interested in this and you go online and you can't find the application yet, the registrar was still playing with it last I knew, you can go ahead and apply for the nurse leadership course because the core courses that you begin with are the same. And then we can just trade that out at no cost once it's available within our system. There are 2 times during the program that you need to be on campus. One is for the intensive at the beginning, and we have those dates 4 years out in advance. So when applying, you can look and say, okay, I'm going to start in the fall of 25, the spring of 26, whatever the case may be. You can look on our website and find those dates. For example, this year, the intensive is it's the week before classes. So it is the 18th, 19th, and 20th of August. All of our DNP students need to come to that. From there, you need, at Penn State, you need 5 days in residence for any doctoral program. The educator and the leadership students meet that second requirement when they come for their comprehensives. The NP students do that on via Zoom because they have practicum or clinical intensives that come late. So again, as DNP, nurse educator, nurse leadership students, you come to campus twice. Once for the intensive at the very beginning for orientation, and then one more time during your comprehensive. Your final oral presentations are all done via Zoom. And I think.
Thank you, Dr. Motter. We'll hear a little more from you later with the more explanation on the DNP project. But now we're going to do a little piece on each of our nurse practitioner options. So I'm going to turn it over to Dr. White now, who will tell us about the family option and the primary care option.
Sure. Thank you, Cody. And I can reiterate a lot of what Dr. Motter has shared. So as we look at the DNP family nurse practitioner option, of course, we're going to look at care across all ages. And with primary care, we're looking at preventative measures as well as managing chronic conditions and taking care of acute needs as well. You can come in very similar as Dr. Motter shared at the BSN level or the MSN. So we do complete a gap analysis to determine what courses you have taken if you are master's prepared so that we can look to accept or transfer credits as well. This is really on an individualized basis. So we look at this syllabi and then make a determination if the course is able to be transferred to you. So it could, if you have a master's degree and you're looking at our FNP option, again, we may be able to look at some transfer credits. As Dr. Motter shared, it does look a little mind-boggling that we have over 1,000 practicum hours, but these are really separated into two specific areas. One are your clinical practice hours. Those are your NP practicums that we have a clinical coordinator, Dr. Susan Maynard, who works on your clinical placements. And these 600 hours are those precepted hours where you're out in a clinic. So in the family nurse practitioner option, you're in a family practice primary care site. We do like you to do women's health hours so that you're competent and comfortable with doing women's health exams. And we also allow that some of these 600 hours, you do a specialty rotation. So if you have an interest in dermatology, if you have an interest in a pediatric site, if you have an interest in pulmonary or cardiac, we work with you to find those clinical placements to enhance your skills as a primary care provider as well. And then just as Dr. Motter referenced the doctoral hours, the 431 hours there, these are all linked to the DNP project that she'll speak of shortly and are really integrated with your DNP project courses. Of course, upon graduation, you are eligible to take the National Family Nurse Practitioner certification. And looking at our other primary care option, Adult Gero, very similar in design as the FNP, only we have a few less credits, and that's because we take out the pediatric specific didactic and practicum course that is included in the FNP option. So it's still 1,031 practicum hours with those two distinct areas, your NP clinical practicums, as well as your DNP project hours. And upon completion of the Adult Gero, you are also able to sit for the certification to be an Adult Gero NP as well.
All right, thank you, Dr. White. Appreciate that. And now we are going to turn it over to Dr. Ryer for some details on the acute care option.
Yes. Oh, thank you. So I'm going to start out by saying that if you are at all interested on the inpatient side of clinical care, then the acute care option is probably for you. It doesn't necessarily mean, although we educate on the critical care side of things, it doesn't mean that you have to work in an ICU. I feel like there's a lot of confusion about that, about the role in itself. So I just wanted to kind of clear that up a little bit. If you're interested in the inpatient side of healthcare, then the acute care track is right for you. So our program is 55 credits. Again, if you're coming in with that master's, we do a gap analysis and take into account coursework you have already taken. We also fall into the 600 clinical hours bucket, just like Dr. White does, with 431 of 1,000 being in your DNP project. Our clinical hours are focused on the inpatient setting. So we like all students to do at least one critical care rotation as well as one general medicine hospitalist rotation. And then certainly there's plenty of time to try on different subspecialties as well that you may be interested in. And then Dr. Maynard also works with me as well as you to find clinical placements that really are areas that you're interested in. Because as you're a student, those are the best times to make yourself a little bit uncomfortable and go outside what you're normally practicing to really try on other practice environments to see if you like it. Because the role really varies not only by institution, but also by unit. So we really work with you there to figure out what's your goal. What are you thinking about when you graduate, and how we can try and get you some experience that would really be a good fit for you for that. Our students do come in with two years of acute care experience, so 2 years on that inpatient side. And the reason for that is, we really build on that foundation as a nurse and that knowledge base. And some of the more complex critical care topics are difficult, are a little bit more difficult to wrap your mind around without that solid nursing foundation. And so we really find that students are much more successful when they come to us with that acute care background of at least 2 years. And then for our program, you're eligible again to take national certification, and there are 2 different certifying bodies who accredit acute care. So at the completion of the program, you're eligible for either one of those certifications.
All right, thank you, Dr. Ryer. So next up is our psychiatric mental health nurse practitioner option. Still not seeing Dr. Farrell on the line. I'm gonna assume she had some Zoom difficulties or something today. So I will ask if maybe either Dr. Motter or Dr. Pandium, if one of you might be able to share a little bit of insight about one of those, about this option in her place.
Sure, I can do that. And I believe her granddaughter was graduating this morning, so she was
Okay.
hoping on time, but those speeches sometimes go longer than we thought they were going to be, right? So I'll fill in for Dr. Farrell. We do have a psych mental health option, very much follows the model as Dr. Ryer and Dr. White explained. It's 59 credits. You can come in at a MSN or a BSN level. If you do have an MSN, then probably the psych mental health certificate program makes the most sense, but we do meet with each individual when they apply for the program. We do a gap analysis, as was alluded to earlier, and see what is really going to work best and fit best for you. The practicum hours are listed here, just like with the other programs. And this program as well does the intensive at the beginning of the orientation intensive in August, and then your practicum hours are all done locally, and we help you find sites if you cannot find clinical sites, and then there is a period of time where you are at Hershey Med for an in-person intensive. So that's how we get your intensive days satisfied for the university, and it's a good time to be together and hone on those assessment skills before you go out and practice with other people locally in your community. As with the other programs, you're eligible to take the national psych mental health certification exam once you complete the program, either the certificate program or the DNP program. So mirrors the other programs that we have talked about, except of course all your clinical time is in the psych mental health realm.
Thank you, Dr. Motter. Just some other bits and pieces about the DNP curriculum. For all of the options that have been mentioned, our typical completion time, if you follow the standard plan of study, can be as short as 8 semesters. So it works out to about 32 months. If you're entering with an MSN, it may be less. So that might depend on which courses you need, which courses are offered at certain times, and things like that. But our standard plan of study is a BSN to DNP in 8 semesters. Now, that said, we certainly have flexibility there in the way that we can structure your plan of study. If you aren't able to complete that 8-semester plan, we can move things around for you and find a plan that works for you to complete the degree. We don't want you to feel like you are beholden to complete things, within that shortest frame of time, but we want to make sure that all of our students are successful and that they are able to manage multiple responsibilities. The vast majority of our students are working full-time and pursuing their coursework at the same time. And we don't want anyone to get so overwhelmed by feeling like they have to complete certain things within a certain amount of time that they aren't able to do it all. So if you do need, those kinds of accommodations, if you need some specialized planning to make your plan work with the other things that are going on in your life, we're happy always to sit down and figure out how that can work for you. Adding to the flexibility is the fact that all of our courses are offered asynchronously online, so there aren't set times when you're required to log on for lectures or class activities. There might be times when you need to coordinate with an instructor to meet one-on-one, or some instructors might do virtual office hours or something like that, where people can log on at a certain set time and ask questions or things like that. But those aren't going to be required, at a certain time for an attendance grade or anything like that. And as has already been mentioned, a lot of these practicum hours are incorporated into the courses. So those hours will be done at sites near you. And again, we're happy to help you however we can to secure those sites and preceptors that you'll need to complete the program. One thing we do want to mention is there will be an exception to this once we roll out the DNP nurse anesthesia option. That program will require students to be at Hershey for Hershey Medical Center for the 3 years of the program. There will be some online courses mixed in there, but all of the nurse anesthesia courses themselves will only be offered in person there. Once again, for the intensive sessions, leadership and educator students will come to University Park for both of their intensives. And for the DNP NP students, you would have that first orientation at University Park. And are we still doing 2 intensives or 1? I believe we had some revisions with the curriculum last year that was previously 2 separate clinical intensives, but has that just been reduced to 1 now?
It's still 2. There's
It's
one.
still 2, okay.
Yeah, there's a baseline where you really hone in on your assessment skills of your at the end of your first full year. And then there is a second session in May, the year before graduation.
Yes, and if you don't mind, Cody, I'm just going to chat about this for just a sec, because I should have mentioned it in my little blurb and I didn't. So for the nurse practitioner programs, these are really awesome times where we get to be together and you get to learn from your colleagues. You get to see most of your faculty and work one-on-one with everybody. We spend time in the simulation lab going through cases. We spend time in the classroom learning about things. So yes, it does happen twice. Once in June and once in May, and those dates are, published well in advance, so and you can plan your life around those dates. But there are times when we're together really enforcing the material that you've been learning throughout the program. And they're just a really fun time where we kind of get to all be together at the Hershey campus for the clinical intensives and really practice our skills together and learn one-on-one. So I just wanted to put a plug in for those times. Yes, we are in person. Yes, they are at the Hershey campus. And they are, 3 days in a row, typically 3 or 4 days in a row, but they are a really good time and really a great way to bridge the online content with in-person skills.
Thank you, Dr. Ryer. Appreciate that. And to that point, I think one of the things that we like to highlight is that even though most of this program is online, you do have those in-person components where you're getting to meet your faculty in person. You're getting to meet the other students in your courses. And not all programs offer that. If they are exclusively online, you might feel a little more removed, I guess, from the people who are teaching your courses, who you're interacting with in your courses. And we really try to foster that sense of community among our students and faculty to make sure that you feel like you've got a place here and you've got people who are supporting you and who will help you with whatever you need throughout the program. And also that in-person learning experience definitely seems to be really beneficial in, as Dr. Ryer said, developing those skills that are just harder to teach maybe in an exclusively virtual environment. Okay, now some information on our scholarly project that's required for DNP students. So I'm going to turn it back over to Dr. Motter now. Oh, still on.
Thanks, Cody. I'm sorry, I was still muted. Um, so I think that's probably one of the big mysteries when people start the DNP program is, well, what is a scholarly project and how do I even know where to begin? First of all, let me say, before you start any of the project courses, we do have the intensive at the beginning of the program, and that is in August. So before any of the scholarly project courses start, we start with 590, which is really the introduction of what is a scholarly project. It can be a quality improvement project. It can be a based project. Sometimes they take another slight turn, and that's really a conversation that happens between you and your advisor and later announced to your committee. But I'll give you an example of something that was totally different. Is we had a student at New York State who was a CNS and worked on a project to have the state legislature give prescriptive privileges to CNSs who were working within ICUs in the state of New York if they were working specifically in one type of unit. And that legislation was passed as a product of her scholarly project. I will say that is an outlier. Most are either evidence-based projects or quality improvement projects. And we will explain the difference to you during our 590 course in the very beginning. You will be assigned an advisor. We do assign advisors fairly early, and your committee members, you get 2 committee members after that. Once you do your qualifying exam, which I'll talk about in a minute, we look and see if there's something special you're working on. And if it's something that we have a faculty member that has a special interest in that, we make sure you team them up with that because we want you to be working with the experts. And an example of that is someone who is not on DNP faculty, but is in graduate faculty is Dr. Loeb. And she does a lot of her life's work has been working with healthcare in prisons. And we sometimes have students who are working in prisons and that's where they want to do their project. So we put Dr. Loeb on their committees then to help guide them through as well as their advisor. So we really do try and make when possible. So once you're in the program, there is a qualifying exam that is a portfolio that's put together. It's done virtually. The qualifying exam is really what we work on in 590. So when you leave 590, Dr. Light and I give a lot of feedback. And if you take the feedback, implement it, put it into your portfolio. There's also a video that you do as part of that portfolio. You review it with your advisor. Your advisor's there every step of the way. As long as you give them plenty of time, you can't give it to them 24 hours ahead and expect to have it turned around. But they will give you a timeline of when they would like it by. So once you pass your qualifying exam, the next thing is comprehensives. In person for the leadership and educator students, virtually for the NP students. And that is part of the coursework in course 837. And that's where you talk about what is the problem, who are my stakeholders, how am I going to address this problem or this project, or what is my plan? So that's your plan. Your plan needs to be approved, and that's what the comprehensive does. Then you spend the next summer, so that happens in the spring. The following summer is implementation. And that's when you take whatever your plan is, it's been through the IRB, and you implement it to see what happens. Did it make a difference? Did I make a change? Was there improvement? Was there not improvement? Is this moving through the legislature, or have I hit a stop? Right? So it's the progress of the project. And then you spend the fall taking your data, and we do have a statistician that works with you. And you take your data, you look at it, you explain it, and then there's a oral presentation. This part of the course is taking a little different spin. It used to be, and we are still in this year's group, it's a large paper, probably 150-page paper that is coming out of that. We are in the middle of reworking that. So starting next year, The paper will probably not be part of it. There will be written work, executive summary. There will be a literature table and a literature review of your problem. You have to understand the problem before you can explain the problem. But the final oral presentation will be part of probably an executive summary and a poster presentation, and not the 150-page paper that exists today. So, like I said, we are trying to make what you come out of this program usable. And I was a previous CNO, and I will say, as a CNO, if someone came to me with a problem and knew their stakeholders and wanted to address something, I probably wouldn't have read a 150-page paper. I might have looked at their poster presentation. I certainly would have read their executive summary, and I would have listened to their oral presentation. So our philosophy behind this is giving our students the tools they need to continue to improve care, you know, as they are leaders. And it doesn't matter if you're graduating from the MP program, the educator, or the leadership program. With your DNP, you will be recognized as leaders, and we certainly want to give you the tools to make that work. So that's why there's the, I think this is a fine example. We see that our students will gain from this, and we're always reinventing ourselves, always looking at how to improve this for our students. And here are the courses I was talking about. So 590 is the introduction course that happens where you start to look at what is the problem, both locally and nationally, and then and understand who your stakeholders are. And we have to make sure that you have stakeholders who are invested, because if they aren't interested, the project goes nowhere. Then in 831, it's where we look at the evidence and get our evidence tables. And in 837 is where you learn how you're going to work your way through this project. And then 835 is repeated 3 times. First is implementation. Second is looking at your data and understanding it and writing to that. And then third is final oral presentations, poster presentations. And there really are many opportunities throughout Penn State and throughout the college and the university that we really encourage our students to take the work that you've done and share it and present it at. And we did have several of our students last year present at national conferences such as the Magnet Conference, which is a pretty big deal. That's a tough conference to get an oral presentation. And she did present on healthcare violence, certainly a hot spot right now in healthcare. And so that's what our students are doing, which I think is pretty exciting, that we are making it real life experiences that they can use in their work on a daily basis.
All right. Thank you, Dr. Motter. Just going over now a couple of the admission requirements for the DNP options. So we do have rolling admissions. So we accept applications sort of up to a year in advance, basically, for all of our programs. So you can start in the spring, summer, or fall semester. It's still not too late to get in for this fall if you are thinking about that. I'll go through the dates a little bit later on, but just know that you can, we're already accepting applications for spring next year as well, and we'll start for summer very soon too. Typically, we're looking for an undergraduate GPA of 3.5 or higher, or if you have already completed a master's, 3.5 or above on your master's coursework, and grades of B+ or better on all of your science and nursing coursework. We do have some flexibility with these requirements though. So if you had a 3.4 in your undergrad program, or you got a B- in chemistry or something like that, don't write yourself off immediately. We are always willing to take a look at everyone that applies holistically and make sure that, you know, if there was some sort of aberration some semester where you didn't do so great, or you had some, you know, issues where you had to stop out of the program and come back in or something like that, that's not going to immediately disqualify you by any means. So, you know, you can always reach out and ask us if you have questions about whether, you know, it's worth the time and effort to apply if your GPA was significantly lower than this, or you had some grades in there that weren't so great. But don't feel like you know, must meet all of these criteria exactly in order to apply. That's certainly not the case. We would require all students to have a bachelor's degree in nursing at least, and a valid RN license. As of right now, most of our practicum sites for the DNP NP options are concentrated in Pennsylvania. There's a possibility that we can include students who are living outside of Pennsylvania and would do their sites elsewhere, but those are sort of reviewed on a case-by-case basis, depending on your what your situation looks like. Since all states have some different requirements and things like that, we can't make broad guarantees, but certainly willing to entertain the option of doing sites outside of Pennsylvania based on where you are and what your sites would look like. As for clinical experience requirements, as Dr. Ryer mentioned in her slide, we do require that 2 years of acute care experience if you're going to apply for that option. And our nurse anesthesia option, when that's up and running, would require at least 1 year of critical care experience. But the other options, we don't have a certain amount of time that you must have worked in that sort of setting in order to apply. Sometimes it is helpful to have some work experience there, just so you're a little more familiar with, the role that you might be, hoping to pursue one day and what those, how those settings typically work. But we do have students sometimes that come straight out of a BSN program and right into our program, and we don't want that lack of experience to be a limiting factor for them to be able to complete the education if they know that that's their ultimate goal. Okay, so now moving on to our MSN options. We have 2 options to choose from here, nurse administrator and nurse educator. Both are 36 credits. And I'm going to ask Dr. Motter, since you oversee these ones, if you wouldn't mind sharing a few details about this as well.
Sure. And before I jump into that, I just want to say, don't let the GPA be a rate limiting factor. We really do are looking at our applications holistically. Sometimes there was a lot happening in your undergrad life and you've got life together. And now, as adult learners, we may have a very different outcome. So we're more than happy to have a conversation with you. If you don't want to pay the money to apply, we can certainly look over things with you and give you thoughts on that before you apply. So the masters in nursing, as Cody said earlier, they fully online except for your practicum hours, which are done locally. The nurse administrator is 180 hours. The nurse educator is 270 hours. They are done one-on-one as a nurse educator in some type of educational setting, and for nurse administrators done in a leadership setting. You can go full-time for 2 years, part-time for 3 years. If you take a course or 2 over the summer, that certainly shortens it. There are 3 core courses that have to be taken before you do your practicum. So it's really important that you follow the plan of study, because nothing's worse than someone has everything done except 1 course, and they have to take it in the spring and then have to wait till the following spring to take their practicum. I do monitor everyone's plans of study, and if it looks like you're setting yourself up to have one of those gaps, I make a quick phone call and we make some adjustments in your plan of study. Again, you can begin spring, summer, fall. Orientation is done virtually. So what we do is we tape the sessions that are needed for the MSN during our DNP orientation, and then you can watch them virtually. Admission requirements, again, it says 3.3 here, but we can certainly have a conversation if it's a little lower than that. And we really do set people up for success. Maybe if you had a little lower GPA, maybe start out with 1 course, see how it goes. Oh yeah, I can do this work-life balance thing. And then they bump it up to 2, or I have people that take 1 course at a time and just take a little longer. It's what works for you. And as Cody alluded to earlier, and I'll say it again, 90% plus of our students are full-time workers. Many have babies in the middle of the program. So it is a program. There is rigor, but there is a program with careful planning. You don't have to give any part of your life up, which I'm not a believer of. There's work, there's family, and there's school, and you have to give on up while you're in school. I'm not a believer in that. We're not believers of that in this program. We really work hard to understand what's going to meet your needs, what's going to meet your family needs. And I know it says online program, but I have to tell you, graduation is always a gut-wrenching day for me because I know my contact with these students will become more limited, or so I think, as they graduate. But it is pretty amazing how many I hear from year after year, like, "Hey, Dr. Motter, guess what just happened to me?" Or, "Hey, Dr. Motter, I just got this award." Or, "Hey, Dr. Motter, thanks. That work we did in finance, I was able to get my project approved." So I love hearing from them. We also use our students as a practicum site. Quite often we'll refer our students out and say, "Hey, I know we have Christian right now who just graduated, Christian Weiser, from our program, and he's precepting 2 of our current students." Our students like to precept upcoming students, so it'll be an opportunity for you too as you come into our program and later graduate.
All right, thank you.
One other thing I want to
And
say about the MSN program, and same with the certificate programs, the coursework you take there really does apply if you decide to come back for your DNP. And quite often it's a conversation that happens at graduation where I'm like, "Hey, you know how far you are into your DNP if you just come back and finish with us?" And they give me a call a week or 2 later because I know they need to recover. And many of our students do come back and complete their DNP with us. And the same thing happens with our certificates. Um, there are 9 credits you take in the certificate program for our nurse administrator or our nurse educator. And those will apply directly towards the MSN because they are not given towards a degree. So you can take those 9 credits, plug them right into your MSN. And quite often people come and do the certificates and think, "Hey, I can do this. That wasn't quite so bad. And I'm a quarter of the way there. I might as well go in and get my degree." So for each of the nurse administrator, nurse educator, it's 3 courses taken either in fall or spring, and you can double them up and do it in a year, or you can take a course at a time and do it over 3 semesters. And again, they apply towards our MSN. The NP options, there is a gap analysis done. So all of our NP options have a postmaster's certificate. You meet with the coordinator and they look at your previous plan of study, decide, they do a gap analysis, see what courses you need, and then they are applied. And so it's very individualized for each person. And this is part of the program that we heard what people were saying. And we have recently reworked the NP certificate programs, and they can now be completed in a year. So you start within 1 year, you can sit for your certification exam. And that is for postmasters in that program.
all right, thank you, Dr. Motter. And now I'm going to go through some of the application details. As I said earlier, we are still accepting applications for fall of 2025. Time is slowly ticking away though, so if you are thinking of applying and haven't done so yet, you'll probably want to get working on that because June 30th is our deadline. Classes will start on August 25th for the fall semester, and if you are applying for a DNP program, that first orientation intensive will be August 18th through 20th at the University Park campus. So get those dates on your calendar now. But if you are thinking a little bit further out, we've got the spring deadline of October 1st to start on January 12th, 2026. And summer, that application is not open just yet, but will be before too long. And that deadline will be March 1st of next year with classes starting May 18th. So still plenty of time to think about that. All of our students, whether you're applying for DNP, MSN, or a certificate, have to apply through the Penn State Fox Graduate School application. So if you go to gradschool.psu.edu and you'll, this is the top of that page, if you click that apply button, that will take you to the page with all the instructions. If you've already been a Penn State student in the past, you can utilize your same login credentials. And if your account is not active, you might have to do a recover my account tool to get your account activated again so you can apply. If you've never been within the Penn State system, you just have to create an account. Either way, it takes you through step by step of what you need to do. And the application itself is pretty intuitive, kind of have different pages where you have certain information that you need to upload or attach or fill out yourself. So pretty standard there, but if you have any questions as you work through the application process, feel free to reach out to me. Happy to help you however I can. Any of the degree programs that you apply for, there would be a $65 fee whenever you submit. If you're doing one of the certificate programs, that's a $30 fee. All of our applications also would require official transcripts from any post-secondary institutions that you've previously attended. When you're filling out the initial application, it's okay if you just attach unofficial copies, if that's all you have for your preliminary review of the application, but we do have to have official copies on file before you would actually start in the program. So we would give you instructions for having those sent if you only attach the official or the unofficial copies to your initial application. Again, we do require a bachelor's degree in nursing for any of these programs, either a US degree or if you were educated overseas, it would have to be equivalent to a US bachelor's degree. And if you are an international student, we would have to see English proficiency test scores for some countries. Certain countries do not require them, but if you have questions about any of that, again, feel free to reach out. I'm happy to clarify any of that that you might be wondering about. Our DNP and MSN options also require a personal statement. So this is just sort of a brief encapsulation of what you've done already in your career, why you want to pursue the degree that you're applying for, and sort of explaining anything else that might be good for the admission committee to know about you, anything that's not reflected in your transcripts and in the references that you have to submit and things like that. Sometimes that can be a powerful tool for conveying why it's important for you to pursue the education that you're looking for and why, the things that we're seeing on paper don't necessarily explain everything about you that would be helpful to know. And then the references, these are, people that you trust who can speak well to your ability that to pursue graduate education and to excel and succeed in whatever path you might go down. These are not going to be regular letters, though, that your references will write for you. You'll just submit their email addresses on the application. And when you submit the application, those people all get an email with a link to complete a standardized reference form for you. So all of the Penn State Fox Graduate School applications require those references and get the same reference form to fill out that is a little easier than asking someone to write a regular letter. So just make sure that your references know to look out for that email because your application isn't considered complete until those references have submitted that form for you. There are a couple of other requirements that you may want to familiarize yourself with. You can find those on the individual program pages for each program. If you go to our website, nursing.psu.edu. Maybe all of you have already been there, but you'll find all of the program pages there. And again, any questions about the requirements, do not hesitate to reach out, and I'm happy to help clear any of that up. Okay, now saving one of the big questions for last, how much is this going to cost me? Our tuition is charged per credit if you're taking fewer than 12 credits per semester, which I don't believe that any of our DNP MSN or certificate students ever would take more than 12 credits per semester, but the current rate is $1,037 per credit. So if you're looking at one of the DNP options, a rough ballpark would be $55,000 to $60,000 depending on the option. When the MSN options probably around $37,000. There are some scholarships that are available to DNP and MSN students. Unfortunately, not as many as we would like. So we'd say don't count on receiving one of those necessarily. Maybe cross your fingers and hope for a pleasant surprise. But the majority of our students, if they are looking for financial aid, tend to have more success with utilizing external scholarships, grants, loans, and so forth. Also, a lot of our students are utilizing tuition reimbursement or assistance from their employers as well. So most employers these days are giving $5,250 toward tuition reimbursement. That's, I believe, the federal maximum that you can give toward tuition reimbursement as an employer. So you can have a good chunk at least of your tuition for the year paid by your employer maybe, but you'd want to check with your employer to see exactly what kind of options they offer for that. There also is no tuition difference for Pennsylvania residents or non-Pennsylvania residents. So since our programs are offered hybrid or all online for the certificates, you can pay the same amount whether you're living in Pennsylvania or somewhere else. And we've got students all over the country too. So it's nice to know that the only extra expense you would incur in that case is maybe extra travel cost if you have to come to Pennsylvania for the intensives. All right. So that brings us to the end of our slides. I know that was a whole lot of information that we just threw at you, but please feel free to screenshot this, take a picture with all of our contact information on here, and the email addresses. Dr. Light and Dr. Farrell are the only ones who aren't with us today. Dr. Light is enjoying a well-deserved vacation at the moment, and Dr. Farrell, it sounds like, is still trying to make her way back from graduation. So, but either of them would be happy to talk with you as well, or any of us on the call. We are happy to answer questions now, or if you want to reach out to us individually afterward, you can do that. I am going to stop sharing my screen, and if we have any questions at all from our attendees, please feel free to ask those now, either in the chat, or you can turn your video if you like and audio on and ask away.
I see that Dr. Pandian's having technical challenges with her Zoom.
Sorry about that. No, I was going to say that I think we have George and Michelle on the call, and maybe they can take a moment to introduce themselves and let us know what they're interested in and how we can support them as they're making this decision or transitioning to this leadership pathway.
I'll be a gentleman and let Michelle go first.
Michelle did post a question in the chat.
Oh.
Do you need to apply when placing your...
Oh, maybe she's having issues.
Mm-hmm.
She just
So Michelle,
out.
if you mean, if you're applying for one of our programs and then you want a certificate on top of that, depending which certificate it is, you can do it in tandem. So that's something we could address if you're still on. You can ask that question.
We'll see if maybe she'll pop back on if she was having issues.
Okay. If not, Cody, you can reach out to her and I can answer that for her.
Sure. Well, George, if you would like to introduce yourself, feel free.
My name's, hi, everybody. Thank you for the presentation. Very informative. My name's George Panzak. I'm from Pittsburgh, PA. I have an extensive psychiatric background working at Western Psychiatric Hospital here at UPMC. And I'm applying for the DNP Psychiatric Mental Health Nurse Practitioner Program. I also have my MSN and a family nurse practitioner from University of Michigan, and also have my PhD in exercise physiology from the University of Pittsburgh. So my rationale is to integrate all this together for holistic care. I can go on about other things, but I'll save some time here. But that's my purpose in applying.
That's awesome, George. We're happy to have you as an applicant.
Yeah, thank you.
Yeah, and
nice
Dr. Farrell, I'm sure we'll reach out to you and she can do a gap analysis with you and help you figure out.
I'm sorry, who was that again?
Dr. Farrell. She's the coordinator of our psych mental health. I'm sure I read somewhere her granddaughter was graduating. That has to be first, right? So, but if you send your contact information to Cody, we'll have her reach out to you and she can do a gap analysis with you and talk about, because, we don't want people retaking courses they don't have to retake, right?
Okay, sure.
So
I
we'll work
appreciate
with
that.
it. Yep.
I'm quite familiar with Penn State. I went there briefly before, so.
Okay. And that the graduate I was talking about that spoke at the Magnet conference, I believe worked at Western Psych. She's one of our recent graduates, now going to work at Duquesne as faculty. So,
Okay, thank you.
Yeah, it's nice to see you on the call, George. George and I had some back and forth over the last several months as
Yes.
he's been thinking about applying. So glad to see that you made it today. And I don't remember if I've already shared Dr. Farrell's contact information with you or not, but I can certainly do that
Not
again.
yet, no.
Okay.
I've already applied. So.
Oh, perfect.
right. Well, and we meet personally with each person that once their application's complete. So you'll hear from her.
Okay. Thank you.
Mhm. All right. Well, I'm not seeing that Michelle has rejoined us, so maybe she had to jump off. But I thank you, George, and to everyone else who joined us throughout this session. We will again disseminate the recording for everyone who wasn't able to be here for the entire thing afterward, or those who weren't able to join us at all. So we appreciate your time today and wish you all the best going forward, and hope that we will see you again as students here very soon.
Thank you.
Thank you,
All right,
everybody.
George, hope to see you in August.
Yeah, it'd be nice. Thank you. I
All right.
appreciate that. It'd be nice to be back at Penn State. So,
All right. We'll see you in Happy Valley in August. All right.
okay. See you. Bye-bye.
Bye.
Bye, everyone.